Our next presenter, I don't want to butcher your name, so I'm going to try. Try not to. Manasa Gujju, use of bromelain-based enzymatic debridement in combination with serial skin cell suspension autograft application for deep facial burns, a case series. Coming to us from New Orleans.
Thank you all for being here today. My name is Manasa Gujju. I am a third-year medical student at Tulane University. Today I'll be sharing our experience with a new approach to one of the toughest challenges in burn surgery, deep facial burns. This project started with a simple question: can we combine enzymatic debridement with skin cell suspension to help the face heal better, both functionally and cosmetically? I have no relevant financial relationships to disclose. Some of my co-authors have industry affiliations, but all proceeds from those engagements are donated directly to the Spirit of Charity Burn Foundation to support education and survivor programming. So let's start with the big picture. The goal of burn excision is simple: remove the dead tissue while preserving as much viable dermis as possible. Traditional tangential excision works, but it's not selective. It takes the bad and some of the good with it. You end up with more bleeding, scarring, and pigment mismatch, which are especially devastating on the face, where millimeters of tissue make a difference both functionally and cosmetically. That's where newer, more selective options come into play. Two emerging therapies are currently changing that conversation. The first is bromelain-based enzymatic debridement, or BBED. It's a topical enzyme derived from pineapple that essentially digests dead tissue but leaves viable dermis intact. Think of it like a very controlled Pac-Man that preferentially eats necrosis. The second is skin cell suspension autograft, or SCSA, which takes a tiny split-thickness skin sample and turns it into a spray of keratinocytes, melanocytes, and fibroblasts. Instead of a sheet graft, you're misting a cellular soup over the wound bed, which then reepithelializes from those sprayed cells. So together, you have a selective cleanup followed by cellular repopularization, a sort of a 1-2 punch for functional and cosmetic recovery. Most of the published data on these technologies have come from abroad, and results have been impressive, but US-based data, especially in facial burns, is almost non-existent. From a regulatory standpoint, BBED was FDA approved in 2022 for adult deep facial and full thickness burns, and that label was expanded to pediatric patients in 2024. It's not formally approved for use on the face, the perineum, or the genitalia, so our use of it in this study is off-label. SCSA, on the other hand, is approved for both deep and full thickness skin defects, and as of 2023, even for vitiligo. So both have strong regulatory footing. We're just applying them in a novel way. Our study objective was simple but ambitious. We wanted to evaluate the safety and feasibility of combining enzymatic debridement and immediate skin cell suspension autografting in deep facial burns. We specifically looked at timing, technique, graft take, complications, and length of stay, and repigmentation. Basically, can we do this safely, and does it work as well as we think it should? This is a prospective case series conducted between December of 2024 and September 2025 at University Medical Center New Orleans, an ABA-verified adult burn center. We had 6 patients total, 5 with facial burns and 1 with a scalp burn. The group ranged from 16 to 52 years old, with total burn surface area involvement between 10 to 67%. Our study population primarily reflected Fitzpatrick types 3 through 6, which is consistent with the diverse demographic of our burn center and provides valuable insights into the post-burn pigment outcomes that are often underrepresented in literature. BBED was applied under occlusion with petroleum barriers protecting the eyes and ears and removed after 65 to 150 minutes, sufficient for selective eschar removal while preserving viable tissue. The dwell time, which is intentionally shorter than the manufacturer's recommendation, was adjusted to align with concurrent excision and grafting of other major burn sites. Once these procedures concluded, BBED dwell was terminated to avoid prolonging operative time solely for facial treatment. After that, we applied SCSA using a donor biopsy of less than 6 square centimeters, processed into a 20:1 concentration, and sprayed over the debrided area. Early on, we did do 2 sprays for redundancy. Later, we realized 1 was enough. Intraoperatively, we saw clean punctate bleeding and excellent dermal preservation, which makes for an excellent wound bed for grafting. As noted in the post-treatment image here, there was minimal bleeding and the tissue stayed warm and perfused throughout. So we were able to go straight from enzymatic debridement to cell spray in a single procedure, no delays and no return trips to the OR. This table summarizes our 6 patients. The key takeaway is that all facial and scalp burns were mixed depth. So we were truly testing whether BBED could preserve dermis in complex, real-world wounds, not just clean, full-thickness injuries. Looking at outcomes, the days per percent TBSA ratio was generally below the class benchmark of 1 day per percent TBSA. Another result here is cosmetic potential. Because we included patients with Fitzpatrick types 3 through 6 skin types, we were able to observe repigmentation across a diverse group, and early outcomes were very favorable. So the table tells us 2 things. The therapies were applied to challenging, variable burns, and despite that, we still saw promising signals in both length of stay and aesthetic outcomes. Our first case example here is of a 42-year-old man with 57% TBSA burn and blast injury from a home explosion. We used the combination of BBED and SCSA on his face and traditional tangential excision and autograft for the rest of his body. He had some tough complications, including empyema and malnutrition, but his facial wounds healed remarkably. As you can see in the last image here, by post-op day 59, the area was fully reepithelialized with excellent contour and pigment match. Our second case was a 52-year-old man from a recycling plant explosion with a 19% TBSA. Again, enzymatic debridement and SCSA on the face were applied. By post-op day 6, he already had visible epithelial islands forming, and by day 76, complete healing. What was striking was that this patient was Fitzpatrick type 6, and his pigmentation normalized beautifully, as you can see in that last image, something that's incredibly difficult with sheet grafts or dermabrasion. And our youngest patient, a 16-year-old girl with 10% TBSA flame burns involving the scalp, face, and upper extremities. We used a hybrid approach, tangential debridement where necessary, and enzymatic debridement elsewhere followed by CSA on the scalp. She reepithelized by post-op day 8 and discharged soon after. For a teenager, that's huge. Faster healing time means fewer dressing changes, less pain, and less long-term scarring. Although this injury resulted from a flame burn, similar scalp burns are often seen in Black women after hair straightening accidents. This makes the case especially meaningful. Preserving the dermis and hair follicles allowed for early regrowth in an area of both cosmetic and cultural importance. Our goal of preventing alopecia and maintaining follicular viability was achieved with visible hair growth throughout the retreated region. Across all 6 patients, we observed complete reepithelization with excellent graft take, no major infections, graft loss, or delayed healing. None required sheet grafts, split thickness grafts, or reoperations to the treated facial regions. The mean length of stay was 0.97 days per percent TBSA, which is well below the BCQP mean of 3.2 to 3.4 days per percent TBSA. It's a pretty small sample, but we believe it provides a meaningful signal, especially for large burns that typically have prolonged hospitalization. In summary, this combination approach of BBED plus immediate SCSA was safe, feasible, and dermis-sparing in deep facial and scalp burns. We believe this method could reduce the need for large donor sites, shorten length of stay, and improve pigment and contour outcomes. Our next steps are to expand this into a larger control study to further evaluate outcomes and refine our protocol. I want to close out by thanking our entire burn team at University Medical Center. This project was a true team effort supported by the Spirit of Charity Foundation and conducted without any industry funding. And of course, a heartfelt thank you to our patients and their families whose resilience and trust inspires everything that we do.
Please support our mission to improve quality of patient care through education. Join us, follow us, and share this content with family and friends.